On this episode of the Ask Mike Reinold Show, we talk about our return to running progression after an injury.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I'm here at Champion PT and Performance answering your questions. Anything you want to talk about, physical therapy, sports medicine, performance, career advice, we're here for you. Head to mikereinold.com. Click on that podcast link and ask away. I am here today, a little smaller crew today. We have Kevin Coughlin, Dave Tilley, Dan Pope, and Lenny Macrina here for your questions. Leonard, who do we have for students today?
Yes, we always love to introduce our students. They are amazing as always. We have Jackson Boggs from Kentucky University of Kentucky, the Wildcats. We have Libby McCann from Northeastern University, and they were running a special. We got a BOGO. We got Noah Sprinkle from also Northeastern University. So it was we had a Groupon for a Northeastern student. We cashed it in, and then we have Devin Limerick from New York University. I almost said Northeastern University. NYU. Devin from NYU.
Nice. Love the NYU. Is Groupon still a thing?
I think so.
Interesting.
But not a lot. Like it exists. It's like AOL is a thing, but it's not a thing.
Fair. That's a good point. That's a good point. I love that. All right. Who's up first today for students? Who's reading the first question?
Yeah, I have a question from Katie from New Mexico. One area that she seems to struggle with the most is developing a return to running program for her athletes. So how does Champion develop a return to running program after an injury or surgery?
Awesome. Good one, Libby. Wow, we got one. I think we just entered the Kevin Coughlin wheelhouse.
I'm going to sit here and listen to Kevin give a master class on running.
Kevin, how many marathons you running this year? What's the plan?
I just finished one, and I got one planned for the fall in Dublin, so that should be fun.
Wow, just two this year? Taking it easy?
Just two, yeah.
That's amazing. Good stuff. So, I like this question. I think, Dan and Dave and I, we started our online mentorship a little bit, and I feel like one of the areas that a lot of people are saying they feel the least comfortable with is this return to sport progression, this late progression. And I think running's a big one for that, right? And sure, there's lots of like easy ways you can start doing, running. But I think unless this is something that you excel at, it's probably not something that I'd say we're optimizing as best we can. So I think this is a good question, Kev, in terms of the way it's phrased from Katie here too, is that, it's not necessarily like getting, to run your first 5K or a marathon type thing, but you have an athlete, field sport, trying to get back, running program, any injury, ACL, knee, whatever it may be. What's running through your head, Kev? How do you work somebody through that?
Yeah, I like the way you frame that, because there's so many different types of return to running programs. And I think the first big piece of information that you need to get as a therapist from your patient is what type of running are they trying to get back to, right? Is this a track and field athlete or cross country athlete trying to get back to running high volume, high distance running? Or is this a field sport athlete like a soccer player trying to get back to soccer? Because those two types of return to run programs will definitely look differently. So kind of that's the first piece of information I think you need to get. What I would ask the patient is, if you weren't injured right now at this point in your season or off season, what types of running are you doing, and how many days per week? Because a good way to think about this is just starting with the end in mind. So, if you have a soccer player who's in an off season, maybe for conditioning, he's running 3 times a week. So that's something you want to think about when you're about to develop your program. Versus if you have a long distance runner, cross country runner, or master's level adult who's training for longer distance, they might be running 6 days per week, and that program's definitely going to look differently. So I think the first thing is, figure out what type of running they need to do, and then figure out how many days per week that they're usually doing that type of running. And then from there, you can kind of start plugging things in. So, as an example, I guess recently I worked with a kid with a bone stress injury, cross country runner. So, that's kind of straightforward in the sense that he needs to be running 6 days a week, about 50 miles per week. So, bone stress injury, you're really building from the ground up. So you kind of have full control from the very beginning. And usually what I'll do is I'll try to get those 6 days as quickly as possible, but it's going to be a lot of cross training. And I think cross training is a good way to think about building return to run programs, because you're able to build some of that volume with a little bit less impact. So perhaps, those 6 days, maybe 3 of them are cross training. And then on non-consecutive days, I'd start a walking program. And it's really that simple of, okay, so you're usually running anywhere from 40 to 60 minutes on these days. Let's start walking 40 to 60 minutes and make sure that's tolerated well. And then we'll start building in kind of walk run progressions. And then conversely, if it's not a distance runner who's actually building that much volume, and it's more of a, soccer player who's running a few days a week, I would think about, they need to be doing some type of conditioning. So maybe at this point with their injury, that longer like zone 2 effort stuff might be better off on a bike if the impact of running is bothering them. And then maybe we can focus on, some quick sprint sessions that they need to be doing and some tempo type sessions that they need to be doing. So, there's a lot of ways we could work through this, but I think, getting that baseline information is super important. And then obviously understanding what type of injury they're dealing with, right? So if this is a bone stress injury, our progressions are going to be a lot different. And what type of pain they're able to run through is going to be a lot different than if this is a soft tissue injury, right? If this is like a chronic tendon thing, you can be a little more aggressive with your return to run program. They're able to run through some pain. I usually tell them in the case of soft tissue or tendon, unless it's like an acute muscle strain, obviously, but building up to like a 4 or 5 out of 10 pain, if it's not changing the way you're running, is okay. You want to make sure it's kind of warming up, and then you can keep progressing with your program. Versus a bone type pain, we're comfortable with 0 out of 10 pain. So if you're having issues with that, we definitely have to modify a little bit more. And then I guess the last thing I'd say is just in terms of like really specific programs. One of my mentors for this has been Chris Johnson, and he works a lot with endurance runners, so the longer distance type stuff, but he has a lot of good programs that he's published over the years that really just, you take your chunk of volume that you want to run, and maybe it's 40 minutes. You start with something like walk for 4 minutes, jog for 1 minute, you repeat a certain number of times. So for that 8 times for 40 minutes, they complete that session twice, make sure that it goes well both times. And then that next phase, you're just adding a minute of running and taking away a minute of walking. So I know that's a lot, but there is a lot to it depending on the athlete.
Yeah, no, that was great. And I love the way you framed it a little bit here too, where there's a big difference between a field sport athlete and then like a long distance running athlete. And you have a return from an injury to running, but then also it becomes a workload progression, right? And I think the other thing I really liked about what you said too is like there's ways to keep up your cardiovascular using other machines, bikes, rowers, whatever it may be, that can keep your cardiovascular up to an extent, right, without the impact that you see. Awesome. What else? Len, I mean, ACLs, you're doing a lot of ACLs, right? And those sorts of things. You have somebody cleared by the doctor to get back to running. What do you do?
Yeah, I clear them as well. making sure that they're hitting the metrics.
That's a good point, right? Let's assume that we agree with the doctor that they're ready to
Right,
run,
right.
because sometimes we
Yeah.
don't. I like that.
I've already set the stage post-op day one. Like, they're going to clear you at 3 months, and we're not going to have you start running at 3 months. They're just going to say, all right, you're good to start running. But I like to use roughly about a 70% limb symmetry index. There was a paper that looked at hamstring autographs that came up with that number. So, I'm calculating, I begin my testing around 10-ish weeks, 12 weeks. And then with the goal of having them start a jogging program about 5 months out of surgery, roughly. And depending on what's going on, if they, like, I got a kid right now with a big bone bruise and his knee's still swollen and stuff. So I have to delay things a little with him. But around 4.5, 5 months. And then if they hit the metrics that I'm looking for with strength and they're able to do some plyometrics, their knee is quiet. I just tend to use the Delaware program. Lynn and her group out of Delaware have a nice program that they wrote up in JOSPT that is a walk jog program that I've been using for a few years now, or at least more than that. And it's easy. It's they have a treadmill program and they have a track program. And depending on what the goal is of the person, it's a walk jog program. And it slowly increases volume of runs and takes away the walking portion. And it seems to be a nice, easy program that people can do over, I think it's about 6 weeks or something like that. And gets them back depending on the sport. And then it depends on the sport after that, what they're trying to get back to. I typically see, the soccer, lacrosse, the run, a sprint, and then jog kind of athlete. And so you tailor it to them. But like Kevin said, they're doing a bunch of cardio otherwise with bike sprints and sled push poles and stuff like that. And then you supplement their running program with that. I use that Delaware program and maintain that quiet knee, hopefully. So that's kind of my insight into that.
Yeah, I love it. I think, a big part of what Lenny said there too is don't forget that. Well, I actually like how you said you delay it, right? Because you're right. Physicians a lot of times will say week 12, and then you're talking about 4 or 5 months to not start running, right? There's so much progress we can make between month 3 and month 5 in the gym, right? With strength and force development and plyometrics, right? And keep that in mind too. Like, if you start at week 12, man, you haven't gotten to a lot of the good stuff, and you're starting to do some pounding to an extent, like with running. That's some pounding. That's increases in your percentage of weight, right? But I think that's a good tip, right? And if you're an early career professional, you're reading a protocol and it says week 12, I think a lot of people might kind of start that. But wow, like, we love to use those 2 months to get them in the gym and get some strength, get some power, do some plyometrics, so that way then the running progression is kind of easy, right? I think that's the
really
goal,
is.
right? You don't want to flare them up week 12 to week 16. You don't want to flare them up because they start doing it, and then you're not making strength gains from month 3 to 5. That would be terrible, right? So Kev, you want to jump in on that? And then I know Dan and Dave want to jump in too, but
Yeah, one thing I just wanted to say on that I was thinking about when Lenny was talking is that I think a lot of these people early on in their running program, we have to make clear that the goal of the running isn't to build cardio right away. It's probably more to get impacts on the leg and get it used to running. So monitoring intensity for them is really important. I think a lot of our field sport athletes are used to just doing higher intensity running. It's more like the distance runners that are used to doing slow jogging type running. So I think being clear about what the intensity should feel like, whether you want to use an RPE scale and they're doing something for their easy running, like even like a 2 or 3 out of 10 maximal, they should be able to hold a full conversation type thing. And I know that there's that equation of like arbitrary units for a session RPE, where you can just multiply the length of time of the run by how hard it was, and it gives you some idea. So say it was like a 40-minute run at a 2 RPE, that's only 80 units. And you want to make sure that that's kind of where they're sitting, and week to week and session to session, they're not doing a 10-minute run at like a 9 RPE, and they're not feeling good running, and it's probably an intensity issue. So I think, communicating that with the patient is really important.
Yeah, and we use that in all our return to sports, right? Like our interval throwing program, right? It's not you're not pitching day one. We're just building load to your healing tissue, right? It's not about throwing it as hard as you can. It's about building, progressive load, right? Dan, what do you got?
Yeah, I think one of the big elephants in the room, depending on the sport, and then he kind of mentioned ACL, is that a lot of these sports are not kind of straight plain running for long periods of time. They have very different demands, right? Like a soccer player, obviously can be sprinting, walking, changing direction, so on and so forth. So I think the place where physical therapists have some trouble is mostly how to have a good workload starting from like an easy level of exercise to a harder level of exercises, right? And I love all that Kevin said. Usually what I'll do with my athletes, and it really depends on their sport, I'm thinking about this from the very beginning, but once you get to the point where they're tolerating some impact and doing well, I want to incorporate some more impact outside of that sagittal plane. So thinking about more kind of frontal plane, side to side, a little bit of rotation. Usually I start folks off with things like ladder drills, which is, I think you'll see this a lot. If you're in a standard PT clinic, if you see ladder drills, those are like advanced, right? But in my mind, they're kind of like the start of a change of direction program. And once someone's tolerating that well, we might do more shuttle work. And I do a combination of different types of runs. So we're going to be shuffling, which is probably more important for something like basketball, not as important for something like soccer. And we do forward and backwards runs. We do more lateral running. Over the course of time, we have more space between the shuttles, running faster. And then eventually, I think you just get more sport specific. One of the things you can do, because I'm not an expert in every sport, but when I get someone to these end stages of rehab, you can actually see some of the GPS data of what these like high level athletes are doing. So like an elite soccer player is going to be doing somewhere between 5 and 8 miles, right, in a game. And they'll actually tell you how much time they spent sprinting versus walking, so on and so forth. And you can set up a whole session that tries to get a similar amount of volume and a similar amount of like work to rest ratio with a soccer ball. You can get really, really specific if you want to. So I think for physical therapists, think about the sport you're trying to get back to. When is it safe to start these things? How do we start to get outside of that sagittal plane? And then eventually just trying to bridge that gap between what do they need to be, where do they need to be, and where are they currently?
Awesome. Yeah, that's great stuff, Dan. So Katie, hope that helps. I mean, I think we covered a lot of spectrums here, right? How to figure out where to get started, how to progress them through it, how to incorporate some of that agility stuff, like Dan was kind of saying. That to be honest, that's a whole nother episode, right? We're talking about return to running, but then it's return to agility. So we'll see. Maybe we'll put that in the queue for the next batch of podcasts. We'll talk about like a return to agility thing. But you see this, it's a complex question, Katie. And I think that's why people think this is a daunting subject, right? Then you break it down, you look at like the Delaware running program, like Lenny mentioned, right? And you're like, oh, that's pretty simple, right? It's pretty straightforward. It's not rocket science, but it's about a controlled application of force, and I think that's the neat part of it. So awesome. Hope that helped, Katie. Thanks so much. If you're enjoying this podcast, I don't know, what are we close? I don't know. We're way over 300 episodes, so I probably don't have to keep saying this every episode. But head to Spotify, head to Apple Podcast, rate, review, subscribe, all those fun things, and we will see you on the next episode. Thanks so much.